Good morning, good afternoon, good evening, everyone, depending on where you're connecting from. And thank you for joining today's webinar on Infodemiology in Practice. My name is Lucy Kiarie. I am an immunization advocate and a Boost community member. I'll be your moderator for today's session. So you're welcome. So the COVID-19 pandemic has not only revealed the need for effective vaccination, but has also underscored the importance of proactively and systematically monitoring and addressing misinformation. Misinformation has the potential to erode individual and community trust in public health interventions. If you recall our webinar last month on misinformation, a strategic approach, data from Pakistan showed that majority of the people do not strongly believe in misinformation. That was around 75%. As much as this is context specific, this shows that for immunization professionals, it's a window of opportunity for them to form strategic partnerships with people beyond the immunization space so that they can counter misinformation. So other takeaways from the session that we had last month included misinformation is sticky. People continue to rely on misinformation even after, in their reasoning, even after it has been corrected, and they understand, believe, and later remember the correction. So misinformation is very persistent, and some people have it at the back of their minds when they're making decisions, even long after it has been corrected. So we must take an integrated strategic approach to combat the challenge of vaccine misinformation. Let's break down the silos and work collaboratively together and understand our context as well. So our job through social listening is to be able to listen through the fog of disinformation, listen, hear the concerns of the people. So we understand, after listening, we understand the concerns of the people because they have concerns about vaccines, which we need to listen to, and then engage through responding. We respond through trusted voices to reassure them and make them feel heard. So consistent social data analytics and social listening are powerful tools to inform programs, influence decisions, and understand the stickiness of the information. So after listening, let's use this data to inform our decisions as well as the programs. Media and social media can create favorable environment for change. However, peer-to-peer approaches and utilizing trusted leaders in the community is more effective. So during the presentation, again, we had 75% listen more to their peers. So let's get these people who are trusted in the community and utilize them. So pre-banking and proactive counter messaging with positive, true information is more effective than attempting to combat the misinformation. If I can summarize this, I have seen being proactive, being consistent, and also pre-banking before the rumors have spread. So these are the actions that we should take into consideration when we are thinking about misinformation. Let's be proactive, let's be consistent, let's listen and use the data. Let's listen to the online debates and all, and use this data to inform our policies, decisions. Thank you. Next slide. So welcome to today's webinar, Infodemiology in Practice. Kindly mute yourself to limit the background noise and feedback. So use the raise hand function during the discussion to speak. We'll have an interaction section. So use that raise hand button. So for the Q&A, kindly submit your questions throughout the webinar. We'll be happy to respond to the questions that you'll submit. And then use the chat box to introduce yourself and probably share resources that you might have. But kindly use the Q&A box for questions that you might have. Remember to introduce yourself in the chat box as well. So our agenda today, we won't have the usual PowerPoint presentations. We'll have a fireside chat with the panelists. We have two panelists. So the first part will look at misinformation in practice. And then the second part will look at successful strategies. And in between, we'll allow interactive sessions for us to ask questions to the panelists, as well as discussions with participants. Then finally, we'll have recommendations from the panelists and wrap-up session. So allow me to introduce the panelists for today. My name is Lucy Kiarie. I had introduced myself earlier. So we have two panelists with us. We have Claire Waddle, a co-founder and US director for First Draft News. And then we have Saiful Islam, who is an associate scientist with the International Center for Diarrheal Disease and Research in Bangladesh. Welcome, panelists.
Good morning.
So,
good morning from where I am.
Good morning. Good morning, Saiful.
Yeah, good morning.
So welcome, panelists. Maybe before we dive in, during our last webinar last month, we had certain terms like misinformation. Today we are hearing about infodemics. So could you kindly share with us how your work intersects with misinformation and infodemics? Claire?
Okay, thank you, Lucy. It's really a great pleasure to be here to share some of our work experience. So I am Muhammad Saiful Islam. I work at the International Center for Diarrheal Disease Research, Bangladesh, as an associate scientist. Basically, I am a social epidemiologist. I have been working on emerging infectious diseases since 2007. But I have been in contact with rumor surveillance since 2016, when I was leading a program on child health and mortality prevention surveillance network. I used to lead the social and behavioral science part of that program. So in that program, we had a small component that is rumor surveillance, because we introduced a very new method of collecting brain, lung, and liver tissue from the deceased children. That was totally new in a country like Bangladesh. So we expect there might be some rumors. So from that experience, actually, we still running that surveillance, but we learned a lot from that surveillance. And when the outbreak, or now it is a pandemic of COVID-19 occurred in China. So I was keeping my eyes to see what information are generating or circulating online. And I have found that from the very beginning, the onset of the outbreak was identified as a rumor. And the person who notified about that outbreak, Dr. Li Wenliang, he was warned by the local police that why are you spreading rumors? It's nothing. So if you do something like that further, then some legal action will be taken. And this information had been circulating in different ways in different social medias. So then we thought that, okay, wait a minute, we should observe this outbreak very closely to see that what informations are coming, because people are saying that it was from the Wuhan market, it was from laboratory generated. So there are lots of information. There is a storm of information that is that we know as the infodemic, the abundance of information that some are true or some are false. So in that way, our work actually become closely together with the infodemic research. And since the beginning of 2020, we still continuing our surveillance on misinformation. Now we are focusing more on vaccine misinformation, because since maybe from June or maybe from May, we are observing that there are more of misinformation related to vaccine than other topics. So we thought that, okay, let's concentrate on this topic. Thank you, Lucy.
Thank you, Saiful. Claire?
Well, firstly, I'll just reiterate what Saiful said. It's a real pleasure to be invited to talk with everybody today. Just very quickly, I'm an academic by training. I'm a researcher. I have a PhD in communications, and I just thought I was going to be an academic all my life. And then in 2008, I wrote a report for the BBC about user-generated content, because the BBC wanted to know how they could learn how to verify the information that was coming from the public. The information was sending SMS and text messages and email, and the BBC was confused. And so I wrote a report, and they said, oh, could you leave academia for 6 months and come and train our journalists in how can you verify information online? So that was over 10 years ago. I've never gone back to academia, and I now work with newsrooms and health authorities and different organizations around the world. That's what First Draft is. We're a nonprofit, and we focused into all of our work on misinformation. So whether it's around misinformation and democracy, whether or not it's health, whether it's climate, unfortunately, misinformation affects almost everything in our lives today. And so that's what I spend a lot of my time looking at lies.
So thank you. So I know you've touched, Saiful, I know you've touched a bit about infodemic. So you both termed the you both term misinformation around COVID-19 an infodemic. Could you kindly speak to what it means to you and probably the impacts or consequences that you are seeing from this infodemic surrounding the COVID-19 pandemic?
Thank you, Lucy. As I mentioned that actually from the very beginning of the COVID 2019, there was a storm of information that we call abundance of information, somewhere true and somewhere false. That has been defined as infodemic by the World Health Organization. So we actually adopted that definition from the WHO and explained accordingly. And as you said, that what are the impact? Actually, the impact is huge, but there is no systematic surveillance or systematic way to track those impact. Like we have tracked some of the morbidity and mortality that that has been detected by national newspapers or government websites or hospitals. But we know that there are thousands of incidents that we couldn't track because we don't have any systematic system to track those impact. And one more thing, that is the psychological or mental health and the impact of misinformation on mental health, that is completely ignored, and maybe it could be due to lack of funding or lack of interest from the government health sectors or from the local national organizations. So so due to that, we can't say the actual impact or the actual scenario that of infodemic, but the information that we have collected from different sources, still it shows that there is a huge impact of infodemic on public health. And initially it was, the impact was about the cure, about the stigma, discrimination against the people who look like Asian or Chinese. But now the infodemic are actually changing people's views. I would like to say that the vaccination coverage in South Asia, mostly in my country, is almost 90 to 95%. But now people are receiving misinformation related to vaccine, and now they are becoming more hesitant to receive the usual vaccine, like they regularly annually takes the vaccine. So it's not about COVID-19 that the misinformation will have impact on COVID-19 vaccine acceptance, but also the other vaccines that the people are receiving. Now they are getting different kind of misinformation, and now they are doubtful about receiving the other vaccines that they are receiving for their children. So we really need to be very careful how can we handle this. And I think that Claire will share some of our experience. I was reading one of our case report from Pakistan. So yeah, that's all from my side. Yeah.
So the big questions everybody wants to ask about misinformation is how much is there out there and what impact is it having? And as a communication researcher, I would love to be able to give people concrete answers to this. But the biggest problem is that misinformation spreads on social platforms that we can't get access to data around. I don't know what Saiful is seeing on his Facebook account this morning. I don't know what you're seeing on your Instagram account, Lucy. So it's impossible to properly measure how much is out there. We can do some work in trying to monitor these spaces. But as we know, many of us here, a big problem is apps like WhatsApp or Viber or WeChat or Kakao Talk. Those spaces are very, very difficult, if not impossible to monitor. So we've got the problem of how much of there is there out there. And then the other problem is what impact is it having on behavior? And Saiful is right. There's been some moments during this infodemic where we have seen, unfortunately, for example, in Iran, with people thinking that alcohol was a cure. We've seen increases of people in the US going to hospital after the president talked about bleach. We've seen some of those causal moments, and we should be worried about that. But I think the other thing we have to really worry about as people who think about infodemiology is not just individual rumors that it feels like we're playing whack-a-mole and we're constantly trying to bang them away. The biggest challenge, I think, are these online narratives that are about making people lose trust in health authorities, lose trust in practitioners, to not know who to trust. The problem is people are turning inwards to each other to say, I don't know. And the really scary thing in the last 9 months is that people are seeking answers. Where did this virus come from? How do we know how it really spreads? How can I protect myself and my family? And what are the treatments? And on almost all of those questions, we still haven't got definitive answers. And those of us from the science community understand it takes time. Knowledge takes time to develop. But if you're at home and you have suddenly under lockdown, you maybe have lost your job, you've maybe lost a family member, or you've become sick, you're desperate for answers. And unfortunately, those of us in the quality information space can't provide everything people need. So instead, this vacuum gets filled with conspiracy theories and rumors, which are simple, powerful stories. We're all human, and stories work for a reason. And so these rumors that on one hand, we can be like, why do people believe them? Well, they believe them because they help provide an explanation for their lives right now. And so that's what we have to think about. It's not just how do we debunk rumor after rumor after rumor. How do we understand why people are susceptible to these rumors? And we need to understand that in order to be truly effective. And it's both. I'm not saying we shouldn't be monitoring and debunking, but we also have to understand the psychology of why people are susceptible to these rumors in the first place.
Thanks, Claire. So allow me to remind our participants, please keep the questions coming. We'll be answering them as we chat. So Saiful, recently you published a paper on COVID-19 related infodemic and its impact on public health. I know you've mentioned the stigma, conspiracy theories and rumors in our previous, during our previous discussion. So how do you distinguish misinformation, conspiracy theories and rumors in your work?
Okay, actually most of our definitions has been adapted from the previous work, but we have did some modification because of based on our research and the findings. So as you mentioned that in our paper, we defined rumor as abundance of any unverified information circulating online or in the community that can be found as true, fabricated, or entirely false after verification. So a rumor could be true as well until we verify that information, that rumor. So it's a rumor, but if we verify it, it can be found as a true. That's the thing that we added in our definition, or maybe some previous research they used it. And the stigma, we defined stigma as a socially constructed phenomenon through which a person is directly or indirectly labeled by their illness, exposure, travel history, and ethnic descent that further lead to navigate actions and discrimination. I would like to give you some example, like in my country, when some of the people who had, I mean, you know that many of our people, they work in the Middle East. And when they return during the COVID-19, when they visit any hospitals for their healthcare, so the doctors or the hospital administrators ask them that whether they have exposure to Middle East countries. So many people, they hide their exposure history only because of avoiding the discrimination that the other people who faced due to their exposure to Middle East or the history of suspected COVID-19. So you know that the stigma and discrimination that has impacted differently, like people hide their exposure history, they took admission in the hospital and the hospital authority may not took proper infection prevention and control strategies, and then the disease transmitted from the infected person to the hospital healthcare workers. So this is one thing, that how people are stigmatized and discriminated. Even some of the healthcare workers in my country, they couldn't went back to their home because the landlord or the owner of their home, they said that you work in the hospital and you are contaminated, you have the virus, so you are not allowed to visit home, frequently. So some based on that, the government actually organized a residential area where the people can stay during their duty hours or weeks. But it has a huge impact on the psychology of the healthcare workers, because they couldn't see their family members or their sick parents during that time because of their working exposure to the hospitals. And the conspiracy theories, I would like to say that any kind of statements, claims, or discussion of various theories related to the origin of SARS-CoV-2 and its malicious goals. So from the very beginning, we have seen that, that some conspiracy theories were circulating that Bill Gates actually behind the origin of this virus, because he wants to accelerate his vaccine sales. And there are other conspiracy theories that it's a lab-originated virus. So these are the theories that we define as a conspiracy theory. Thank you, Lucy.
Thank you so much, Saiful. Allow me to take a few questions, 2 to 3 questions. So Fardin Khan asks, why there are no laws to put behind bars for people who are spreading fake news, as it harms a nation in a big way and setback for the program goals? Why is it not considered an anti-national act by the lawmakers?
Thank you, Fardin. Actually, I don't know about other countries, but in my country, they have a information technology law, information communication and technology law, and under which they actually arrested several people for spreading misinformation. But due to this intervention, I mean, people started sharing the misinformation through mobile phones, text, and other private messengers. So what happened? Misinformation is circulating in the community, but we were unable to track those, because those are no more public or no more on the social platform. And due to COVID-19, our field level activity, actually, we had to close most of our field activities. So people started working from home. So we didn't have that much field workers in the field or in the villages to know from the community members about different misinformation. So because of that government intervention, it impacted actually our work differently, and people also identified different media to share their misinformation.
Thank you, Saiful. Claire, do you want to have a go?
Yeah, I would just agree that we have to be very careful about chilling effects on speech, and we have to think about this whole landscape. So there's a difference between disinformation, when people are knowingly spreading false information to cause harm. Now, those people are actually very, very small in number. The bigger problem we have is misinformation, when people don't realize that the information is false and they spread it not realizing it. So the reason I get very nervous about this idea of shouldn't we, punish those people who spread it, is most people are not doing this with any malicious intent. They're doing it because they see something that makes them go, oh, I'm worried about my family or my community, and they're spreading it because they think they're being helpful. And so, yes, misinformation is a problem. We're all worried about it. But I would argue that there are other ways that we can educate the public, make them take responsibility for what they share. But that doesn't necessarily mean that you're going to be punished, because Saiful is right. We've already seen over the last 5 years, in many countries, many people are only sharing in closed messaging spaces. And that makes it very difficult for us to understand what rumors are out there.
Thank you. Allow me to combine these 2 questions. Sohini asks, but do you think organizations like Facebook can make use of certain hashtags mandatory when posting anything about immunization, which means one can't post anything about vaccines unless they're mandatorily using the hashtag, which is pre-decided. It's very difficult to get this one done in practice, but it could help track misinformation. Allow me to combine that question with Nitin Srivastava, who asks, is there any way to track misinformation online, basically on social media sites?
So I'll take that quickly, because at First Draft, I have a team of 30 journalists who wake up every day and they sit in front of 2 to 3 screens and they just monitor social media every day. So there is a way for you to track this. You have to use the words that the audience and the users themselves use. You have to have these long search queries, and you're basically monitoring all the different platforms, looking for ways that are talking about this kind of information online. And it can be very helpful. And I saw a question from Bruce Gellin in the chat who said, how do you know what's going to go viral versus what's not? Well, the biggest characteristic is if it makes people have an emotional response. So if it's a rumor that sounds really scary, if it's a rumor that makes people fearful, they're much more likely to share it more quickly. So there's elements of that, and there is technology that helps you track the kind of the curve of the spread. And if it's a very steep curve, you know to move quickly because you know that rumor's moving quickly. If it's more of a gentle raise, you're like, well, it's out there, but it's not really moving at speed. And just quickly, the question about hashtags, the challenge there would be, if I was a bad actor and I wanted to push rumors, I would take that hashtag and I would use it to try and push bad information into those streams. The better response would be for Facebook to work more closely with health authorities and news organizations to make sure that quality information was higher in the feed and poor quality information was lower in the feed. And I think Facebook are learning that. It's difficult for them. Well, they say it's difficult to know what's quality or what's not. Many of us could help them, but that's what we want. We want to see the good stuff up, the bad stuff down. And where there are, the hashtag idea is one of them, but I would worry that bad actors would just get into that hashtag and spread their poison.
Yeah, thank you, Claire. I know that some of the countries also are using artificial intelligence to track misinformation on online platform. I am not very familiar about this technology, but I just, in today's WHO infodemic management course, actually, someone from India, they were sharing that they are using artificial intelligence for surveillance. Actually, it's difficult to identify the misinformation circulating through Facebook than Twitter, because in Twitter, we can use the API key and very easily identify the misinformation through the search engine. But for Facebook, it's a bit complex to get all the information circulating over on the Facebook.
Thank you, Saiful. Keep the questions coming. We'll answer them as we go. So we'll move on to the next activity. So kindly put in, just chat in, use the chat box to answer this. How would you respond to a community member posting or bringing this misinformation about COVID-19 vaccine? So someone says it is a bioweapon funded by Bill and Melinda Gates Foundation to further vaccine sales. How will you respond to such a person who says this, who is convinced that the vaccine is a bioweapon funded by the Bill and Melinda Gates Foundation to further vaccine sales? Kindly chat in. We'll be looking at the chats. We have around 2 minutes for this. And this is a real-time example. When Saiful was working on the paper, this is a real-time example that came from the field, one of the participants, respondents. So it is a real-time example and can also happen when you're working. So just think through how you can answer when someone comes and says that the vaccine is a bioweapon funded by the Bill and Melinda Gates Foundation to further vaccine sales. Which response would you give? Let's use the chat box. Keep those chats coming in. And we'll be happy to sample some of the responses, some of the chat messages. Claire and Saiful, feel free to read one or two messages from the chat.
Sure. So from Robert, he mentioned that I would first ask the community member the source of the post and then take them through why vaccine are necessary and process of making the vaccine. How the community will participate in ensuring their rights and views are considered during the deployment of the vaccine. Okay. Actually, if the people, for example, I was reading one report from most probably from DRC and or some country in Africa. They even don't believe that the COVID-19 exists. I mean, maybe 20 or 30% of the respondents, they say that they don't believe. So if the people don't believe that the virus doesn't have a natural origin, actually they will be doubtful to receive a vaccine. So you are right that we need to actually provide more information, the information from the trusted sources, and the information must be supported by some evidence. And it would be great if we can link this with some local experience. So based on my experience or work in Bangladesh, so we always used to provide them information that about the oral saline for diarrheal diseases. So that was invented by our institute. So when we tell them that this is us who invented this diarrheal solution, so they trust us. Then we say that, yes, these are the medicines or the vaccines that we bring. So you can also trust us for this. So yes, you need to link or give some local examples, and you'll have to make the people understandable about the problem, and then you can, I mean, they will listen to us, otherwise not. Yeah.
Thank you, Saiful. We'll move on to the next activity, the next question, and then Claire can take this up. So, how would you respond to a community member posting or bringing this misinformation about COVID-19 vaccine? So the person says, pneumonia vaccines are effective against the Wuhan coronavirus. Pneumonia vaccines are effective against the Wuhan coronavirus. How would you respond to a community member who says this, who brings this information about the COVID-19 vaccine? Kindly chat as well, chat your answer, and then we'll be happy, Claire will be happy to read one or two and maybe comment on that as well.
I have to say I was very impressed with the quality of the comments that came in on the previous example. I think we've got a lot of excellent infodemiologists already. I'll just wait for some examples to come in, but I'll say on the previous rumor, we do have to be really careful about recognizing where somebody is on the spectrum. If somebody is really already thinking that something is a bioweapon, it's funded by Bill Gates, that kind of rumor is very difficult to pull back, because if somebody believes that, they're already pretty down the line of conspiratorial thinking. That's quite different from a rumor that says you can gargle with hot lemon water to prevent coronavirus. So not all rumors are the same shape or have the same impact. So some of the best responses on the previous slide were things like, talk with compassion and empathy with the person. This shouldn't be, you're an idiot, why do you believe that? I mean, that kind of language, we need to be really careful. We shouldn't just say, oh, here's a fact check, of course you're wrong. Again, we need to say, well, why do you think that? Where did you find this information? Because it's much more effective to get the person themselves to go on a journey to think critically about the source than it is to say, I've got the right answer, you don't, believe me. That's really the worst way to try and counter rumors. So it has to be talking with empathy with somebody and understanding that if they are susceptible to these kind of rumors, they're already a long way along on this journey, and it's going to be quite difficult to pull them back. So again, this is going to take longer with this person to really help them understand the process of how vaccines are funded, the role of the foundation, although I would not go into that. I mean, the more that you say, well, let me tell you about Bill Gates, then unfortunately, Bill Gates has become this figure in this world that it's very, very difficult to specifically talk about him. One thing I'd also say about both of these is misinformation flourishes when there's an absence of quality information. And I would say this as somebody who works in the quality information space. We're not great at comms. We are very good at writing long PDF documents and research reports. We're not very good at making visually engaging, shareable information. And I think part of the problem is we're now having to tackle misinformation because we haven't done a good enough job of explaining how vaccines work, why COVID is spreading. And I think we have to make sure that we understand they're both sides of the coin. And so I would argue that for many of us, yes, we need to be better at learning how to debunk misinformation, but we also need to be better at just communications in general. How can we create more shareable and visual responses? So here with the rumor that pneumonia vaccines are effective against the Wuhan coronavirus, that's partly because people don't understand how vaccines work, how they have to be connected to a particular virus. If there was more understanding in the community about the science of vaccines, they would already know that this doesn't make sense. So I think I would say that the last 8 months should have been a big learning moment for health authorities and journalists and researchers to say, where have we failed in explaining the concepts that are so critical here? Because if by not explaining it, it allows the misinformation to flourish. So when there's confusion and when there's a vacuum of information, that's where we see misinformation. So we need more explainers. We need more fun, engaging YouTube videos that explain things. And I say that to journalists all the time. Where's your high quality explanatory content? Not just a take on today's news, but think about those big issues that your audience needs to understand. Because if we don't explain, that's when we have problems. So sorry, that was a long answer, but I feel quite passionate about this.
Thank you so much, Claire. So I think we'll move on. Keep the questions coming. We'll answer them as we continue with our chat. Thank you for chatting in the strategies that you will use to inform people who don't have the correct information. So we'll go to another session. If I don't know whether I can ask 1 or 2 questions. Let me see whether we have another question that is burning. So would you say that there are certain tactics to rumor spreading which we can use to ensure correct information spreads? If so, what are they? Probably you can touch on that a bit. Yeah, let's have that first.
Okay, Lucy, as Claire mentioned that we don't need to respond or correct all the misinformation, like gargling with ginger or lemon. I mean, there are some of the rumors that are not actually harmful. Like in my country, in Bangladesh, in India, I mean, there are some rumors that yes, the virus stay in your mouth for 24 hours or 48 hours. So if you gargle with ginger and lemon, it might give you some support. So it's not important, but I mean, it's important, but it's not immediate important. But there are some others that may kill people, like drinking alcohol or drinking some drugs that are not prescribed for COVID, but people started buying all the drugs. Like in my country, there was one rumor that was, I mean, maybe the president of the United States, he mentioned about some drug, and in my country, people buy, I mean, from the pharmacist, all the medicines are gone. So the patients who have been suffering for their diseases, they couldn't find the medicine. So they become, they face trouble. I mean, there's the impact. So we need to prioritize, and we need to focus that which we should correct first, and then what we can correct maybe a few days later.
Thank you, Saiful. So, Claire?
Yeah, just to say exactly that, which is we need to find ways to work with the community as well. Because I think in the last 5 years where there's been an awareness of misinformation, there's been this idea that, well, it's the platforms that need to solve this, or we need more government regulation, or newsrooms should be doing more. And I think what we just haven't done enough is working with communities to listen to them, but also to empower them to be the people who are working within their communities to try and stop some of these rumors. And I think that's, I think that's the next phase for the work that we're doing. And the wonderful thing about people who work in infodemiologists, many of the people on this call, is your work is embedded in communities. This makes perfect sense to you. So I'm really excited to see how many of the best practices that have been developed over the last few years can now really be something that's wedded to community work, because that's the secret here. It's not about having an infographic with the WHO logo on and you know, a newsroom logo. This is about communities themselves believing in quality information and holding each other accountable to say, don't share that, that's dangerous. And that should be coming from within. So that I think is the most exciting thing about the next phase of our work.
Okay, thank you. We've seen a lot of recent momentum around the science of infodemiology. So what are we learning about some of the best practices in conducting infodemiology in the context of immunization? Maybe if you could speak to that, some of the best practices.
Okay. Before going to that, I would like to share that there is a rumor that is circulating, or misinformation, that people who have received the flu vaccine, they are more susceptible to coronavirus. It's really dangerous. Like, and they are citing a published scientific article, and I reviewed that article, and I found that there is some twist in that article. Like in the unadjusted analysis, they have found that those who were infected with COVID-19, they also received a flu vaccine. So like 68% people who are positive with COVID-19, they had exposure to flu vaccine, but after adjusting for other factors. So people need to understand that how the scientific analysis is done. So after adjusting for other confounding factors, other effect modifiers, they have found that there is no relation between flu vaccine and COVID-19 infection. But I don't know who picked up that initial primary analysis or the unadjusted analysis. They highlighted that, and they are circulating that information in online platform, that people who are receiving flu vaccine, they are more susceptible to get infection with COVID-19, and it will have a huge impact on receiving flu vaccine in the next season. So we really need to monitor this, and we really debunk or correct this misinformation. And another thing is that who are circulating this misinformation, actually we are not, it's my viewpoint, we are not targeting that people. Like we are generating something, and we are publishing on online platform, but this information may not reach to the local people who live in a remote area, who may not a follower of WHO, who may not follow a good infodemic manager, but he has a network with the local people. So we also need to engage those people, like the young volunteers, because the young adults are more active on Facebook, and they actually share more videos or more misinformation on with the network. So we need to target them to share correct information as well.
So I'll just say a few things, which is the biggest lesson in the study of rumors is that our human brains are pretty rubbish, and we're overwhelmed right now. We are spending all of our time on these machines, and we're scrolling, and our brains are desperate to try and understand everything. And so we are looking for these heuristics, these mental shortcuts that help us understand credibility. But in that context, then people get confused, and because they're overwhelmed. What we need to be really clear about is that we help people. So rather than saying 5 myths about the coronavirus vaccine and listing myth, 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 and repeating the rumor, wherever possible, we need to be very careful about not unnecessarily repeating the rumor when we can. We should always be leading with facts, providing explanatory context so people can make up their minds. And I think something to remember about this is people's worldviews are pretty entrenched. So when you're trying to tell somebody that something they believe is not true, it's very difficult to change their minds. But there's something that Camille Francois calls the ABCs of disinformation: actors, behaviors, content. And too often we focus on the content. How can we debunk the content? But as humans, if you say, hey, this actor used this behavior to try and manipulate you, nobody wants to be manipulated. So it's actually much more effective to help people understand the tactics and techniques that are being used to sow poor quality information in their community, and to explain to them the harms that that poor information is causing on their community, rather than focusing on, hey, you might have seen this, let me tell you that you're wrong. Because in the world where we're scrolling at speed, I'm like, what's right, what's wrong, I don't know. and I kind of turn away from trusted information sources. So that's one of the best practices that we've learned, particularly from political disinformation, that we should now be applying in the health space.
Thanks, Claire. I think you've gone ahead and answered my second question. So maybe in line with that, which is good. So brings us to many people are concerned about the spread of vaccine misinformation, that the spread of vaccine misinformation may affect the uptake of COVID-19 vaccine. And recent research leads us to believe this could be true for some audiences. Maybe you could provide some examples, more examples from your work of successful approaches to managing vaccine misinformation.
Claire?
So there's a lot of discussion, of course, about the anti-vaxxers. People are kind of obsessed with the anti-vax community. But we need to understand that there are many people who are not in those communities. They just have questions about vaccines. And many of them are young mothers. They are just trying to do the right thing for their children. And the problem is when you then go searching online, you will always find information that unfortunately seems to undermine, to get to your fears and to confirm those fears. And people they search more. And unfortunately, there's enough information online for them to then be more and more frightened. And when we're frightened, that's where we're much more vulnerable to misinformation. So I would argue, and there was some great research in the journal Nature about 6 months ago that explained that the anti-vaxxers are better at moving towards the fence sitters, the vaccine hesitant, that are basically just asking questions. And I think that's something that we really need to understand, which is rather than trying to really go after those people, like I just said, the example with the bioweapon, it's Bill Gates. I wish those people didn't exist, but they do, but they're really, really hard to reach. There's actually a lot of people that we can reach who've just got questions and they're desperately seeking quality information. So there's this term, flood the zone, that bad actors use. They flood the internet with bad information. We need to think about how can we flood the zone with good information, but it needs to be visual, it needs to be emotional, it needs to be about storytelling, it needs to be about people's first-person experiences with vaccines. That's what we need to be much, much better at. And we need to make sure that that content is at the top of Facebook when people search, the top of Google when they search, not very difficult to find on a website of a government health authority. We need to be much, much better at that. And I think it's not easy. And as I said, how many health authorities have a really great team of visual designers? Almost none. And so we need to think much more strategically about that, because that's the way we get through this, but it's going to take time, unfortunately.
I'd like to add with Claire that yes, actually we need to make people resistant to misinformation and through cognitive immunization, like giving them more evidence-based information. As Claire mentioned earlier, that for any scientific research, it takes time to get published, because I mean, someone do the research and then submit it to journal, it is peer reviewed, and then it takes time. By the time the people who spread misinformation, they take that vacuum or that opportunity and they spread all the misinformation. So the misinformation reach people earlier than the correct information when it will be available. So we need to give correct information now. We are expecting that the vaccine might be available next year. So this is the time we need to provide information regarding vaccine to people, so that people understand that how vaccine works and what are the process. So in Australia, we have found 1 or 2 rumors that people who participated in vaccine trial died. So if this information actually really spread in the community, then people will be very scary about receiving the vaccine. Anyone may die. I mean, even a healthy person may die tomorrow. So it doesn't necessarily that who participated in trial, and if someone develop any illness, it is due to the vaccine. It could be due to other reasons. So we need to explain this kind of information to the audience, to the people who actually believes misinformation. So this is the time that we need to prepare ourselves, and we need to give the cognitive immunization to the people to make them resistant about COVID-19 vaccine misinformation.
And if I can, Oh,
Yes.
just to just jump in on exactly what Saiful is saying, we also need to understand how narratives shape these debates. So remember when I was talking about we're so busy chasing individual rumors, we've just launched some research, a little bit of a plug, and I'll put the link in at the end, but it's about vaccine narratives. And one of the biggest ones in the English language, it connects vaccines to this idea of liberty and freedom. People are going to microchip me. People are going to use vaccines to surveil me. And it's all about my liberty is being curtailed. Well, the truth is, if nobody takes the vaccine, then you won't be free to travel around and to hug your children. So we need to understand the narratives of the misinformation so we can counter those narratives one-to-one. So I think that's the other thing that we have to understand is we're also seeing narratives that are undermining those people who are trying to push out the vaccine. So whether or not it's Dr. Fauci or the WHO, people are undermining the health authorities and the people. Well, we need to understand that and say, well, how do we therefore have a strategy that counters that? So I think there's so much we need to learn when it comes to, the next 12 months are going to be very difficult for everybody working in this field. And we need to be more sophisticated than just kind of, oh, there's a rumor, there's a rumor, there's a rumor. We need to really understand how this whole conversation is playing out online and how people's cognitive frameworks are being shaped by these narratives. So I talk about atoms of content. Every individual social media post it works together to create a narrative. And that's hard to analyze. When we're doing social media monitoring, we focus on the atoms of content, but we need to really come back and understand how these narratives work and how they're framing the whole vaccine debate. So yeah, we've got a lot of work cut out for us, all of us on this call.
Thanks, Claire. So I'll take a few questions here. Diane asks, how will you advise a country with low resources to approach combating misinformation around the COVID-19 vaccine? How will you advise a country with low resources to approach combating misinformation around the COVID-19 vaccine?
Oh, that's an interesting question, actually. I'm from a low resource country, and I can say that actually they are struggling with managing the COVID patients and the controlling the outbreak. So there is a less priority of combating misinformation or infodemics. But even though they have created a website and they are trying to provide some correct information, but it is not possible for them to respond every misinformation that has been circulating, but they have been prioritizing some of the more dangerous misinformation that might have impact on morbidity and mortality, and they are debunking that through their websites. But I know that many people may not visit government website once in a year. So we need more context appropriate approaches. And in my country, I would also like to say that the people who live in villages, they even don't have access to smartphones and social media. But the misinformation exists there, and we need different approaches like engaging the religious leaders, because this is very common that every Friday people get together for the Friday prayer, and this is the place of where the imams can provide correct information to the community members. So we need some other approaches to engage people who don't have access to social media, but they have been exposed to misinformation.
Thanks, Saiful. So there's another question. So what is your suggestion to address healthcare workers, in brackets, doctors and nurses that spread misinformation? Maybe you can speak to that as well.
This is tough, and I again can relate this from my country perspective, where, for example, there's a famous doctor, and I mean, people actually really knows him very well, but he doesn't have experience dealing with infectious diseases. But he has been invited by the national TV channels to give a talk on COVID-19. And I actually watched his interview, and I was really shocked by seeing what he was telling about COVID-19 transmission pathways and the protective measures. So even I mean, sometimes it's really tough to say something against someone who is a very big figure in the country, and in low resource countries, it is more difficult to say something if someone in a big position says something wrong, and you will have to go with that. What should I say? That sometimes we need to obey their information. But yes, he was found actually wrong on later time, because nobody said that he was wrong, but there are some people who did some videos and provided some correct information about his his speech, and then people understood that yes, even though he is a national figure, national healthcare workers, but what he said is not correct.
Okay, Claire?
No, I would just completely agree, which is there are different communities we need to work with. There are communities on the ground, there are health practitioners, there are also influencers. They might be online influencers, they might be sports stars, they might be faith leaders. There's all sorts of different people who play a critical role in our information ecosystem. And I actually think somebody asked a great question in the chat about journalists. We need to think about all the different people in our communication and information ecosystem that play a role. And we need to do whatever we can to work with them to ensure that they understand vaccines, they understand immunization, they understand infodemiology. You know, we work with journalists every day to say, this is how you should word a headline. Your headline is actually causing more problems, even though the text is fine. The headline or the Facebook post headline is really, really problematic because it repeats the rumor. So we should be thinking much more about how do we, here's the thing, training is not seen as sexy. Nobody wants to fund training, but it's the key way that we're going to get out of this. And we need to be training all sorts of different people who make up our information ecosystem. And all of them are critical, because if a doctor or nurse is pushing a rumor or a footballer is pushing a rumor, it is much, 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 much more damaging. So we need to ensure that we are working with all these different people to make sure that they have quality information, because they can reach a lot more people than you and I.
Thank you. Next, we'll go to discussion with the community, an interactive session. We want to hear from Boost community members who are going to share their experience on managing misinformation. I think I'll start with Sohini. Sohini, if you can unmute yourself. And then also, if you have an experience, you can raise your hand, or maybe probably chat in as well. We'll read it. We'll read your experience. So Sohini Sanyal, I'm sorry for mispronouncing.
Hi, Lucy. No, that's fine, Lucy. You got it correct. Thank you so much. The experience really, I don't have much experience in working with the community, but in terms of social media, definitely I notice a lot of misinformation. And one thing that was being just talked about right now is how headlines are being put up, or how the caption is being put up in social media is often extremely misleading, and then it has nothing to do with even the focus of the content. And I don't know if anyone has any experience in this particular area. That I've seen also that medical experts, or the ones who have the correct kind of information, somehow see social media information as trivial. They don't want to engage. So they would engage in communication when it is face to face, with the community. But in terms of engaging on social media, there seems to be a reluctance. So I don't know if anyone has any experience or anything to share on that from the panel. That would be wonderful to hear.
I can quickly answer the question about journalism, and you're absolutely right. And it's a real problem. Unfortunately, rumors often drive clicks. They drive viewers. You know, as humans, there's something about rumors. This is the best thing I ever learned, which is gorillas, the way they connect with each other is they pick fleas off each other's fur. As humans, we don't have fur or fleas. So we gossip and we share rumors. And so what that means in a journalism context is that it drives traffic, it drives clicks. And unfortunately, journalism is about that we can't get away from it. So even, we try and teach, but we have to understand that context. But your other point is an excellent one. which is we really need health practitioners and experts to become better at using social media. And I would say, and this is a very US focused answer, so I apologize, but at the beginning of the pandemic, Twitter realized that they didn't know who the good experts were. And they went through a 4-week process of giving blue checks, the verification checks, to lots of doctors and nurses in the US. They verified them to know who they were, so they could boost them and put them at the top of the Twitter algorithm. And by doing that, the doctors and nurses were like, oh, I've got an audience. And all of a sudden, these people became really well-known names at the beginning of the pandemic. And so I agree, globally, how can we train up more doctors and nurses to become people who feel confident on social media so that they can be part of the conversation? Otherwise, you're right, social media is full of the rumors and some news organizations, but we're not having people who have the personal expertise that we need.
Thanks, Claire. So next we'll have Akiko Sakaidani and then Atahir Abubakar. Kindly unmute yourself, Akiko, and share your experience managing vaccine misinformation. Akiko? Maybe we can go to Atahir Abubakar.
Okay, good afternoon, good morning, good evening. I have an experience of managing vaccine misinformation when my main A was introduced just of recent, around August 2019. So we have very difficulty in trying to convince caregivers to accept the immunization. So at that time, the rumor going around that a new immunization was brought in order to prevent children from growing so that they won't give birth. So there will be a stunted growth in all the communities. So we have to use religious leaders and some traditional leaders to dispel the rumor, in which we share some experience from other countries, Islamic countries that were practicing immunization fully, like Saudi and Malaysia. So we brought some information, some ulama, some Islamic scholars from such countries who were able to sit down with our local Islamic scholars and discuss with them. They ask various questions in which we try to dispel the rumor. And that's what we are able to do to dispel the rumor for it to be accepted in some part of northern Nigeria, especially Zamfara State. Thank you very much. Over.
Thanks, Atahir. So feel free to chat in your experiences. We'll be happy to read them. So next, I will invite the panelists for their overall and final recommendations and probably suggested tools for use.
Decide for one to start. I've done a lot of talking.
Okay, Lucy, what was your question?
Overall and final recommendations and suggested, maybe you can suggest tools that the attendees can use.
Okay.
Or resources, perhaps.
Yes, actually, I really enjoyed that you put two rumors here and try to understand what people think about this. This can be one way to understand people's response about the misinformation that are circulating, because everyone may not believe what is circulating online, but a few. So we need to understand that what people think about what is circulating about immunization misinformation. So during the pandemic, it's really tough to do visiting communities and collect information face to face. So online platform, particularly in high income countries, the online platform can be a best platform to do some survey to understand people's perception and attitude towards the misinformation that has been circulating. And based on that, we need to develop some strategies. And as Claire mentioned, that these strategies must be different for local level, for national level, and for international level, because we have different audience at different levels. And if possible, I'm not sure, but I'm going to recommend this in one of my papers, that we should also let people know about the different stages in vaccine development, because those who are involved in public health research or in medical science, they know the different stages, but most of the people, may not know the different stages. And there is a common rumor that important steps has been skipped during COVID-19 vaccine development. So we really need some information against this rumor so that people understand that why some of the steps might have been skipped. Otherwise, people will be skeptical about using the COVID-19 vaccine. So, Claire?
So many great questions in chat and Q&A. We could be here for 3 hours. But I just wanted to answer a question that came in about regulation, because I think it's really important. The platforms are absolutely behaving in a way that is not appropriate for a quality public square. There is a lot of awful information on these platforms that is leading to harm, and people are losing their lives. And it is particularly problematic in any country outside the US. These platforms do not have people working for them who understand local country contexts or even language contexts. And as Saufur said, yes, artificial intelligence can go some way, but we are a long way away from having to rely on AI. So yes, we have to put pressure on the platforms, but we have to make sure that we don't roll out regulation that has unintended consequences. And I started this webinar by saying, I can't tell you the scale or the impact of misinformation. So the pressure we should be putting on the platforms is to say, we need to understand what information people are seeing on their social feeds, because until we can understand that, we can't effectively regulate against it. Because the problem with a lot of this speech is it's legal speech. Most of this content isn't false, it's misleading, it goes right up to the line, but it doesn't cross it. So it's actually very difficult to think about what speech we would take down, and it might cause a chilling effect. But we need more research. And last year, we did research asking for people in 14 countries to send screenshots of what they saw when they searched for vaccines on Instagram, Google, YouTube, and Facebook. It will not surprise you that it was awful. We need more of that research so that we can go to the platforms and say, this isn't acceptable. So just in terms of resources, I've just put some in the chat. The first thing I'd recommend is that we have at First Draft, we've been experimenting with an SMS course, because lots of people don't want to go through hours and hours of presentations. So at firstdraft.training, it's a 14-day SMS course. Now, I'll admit that we designed it for the US election. So there are examples in there that are not health related. We're hoping to develop a new version of this for health practitioners. But if you're interested in learning some of the concepts I talked about today, the ABCs, the definitions, how to talk to friends and family, then I would really recommend that. Also, if you're interested in just general training on the things that we've talked about here, let me just make sure that I get the right link, because my colleagues will get angry at me. So this here, we have all sorts of training about how do you monitor misinformation, how do you verify misinformation, how do you report responsibly on misinformation. And for those of you who know journalists, we also have an online course just for journalists, and it's also in a number of European languages as well as Hindi. So that's our online course. And finally, we've just today launched our new vaccine research, and it's as part of a new hub on our site, which has lots of information about vaccine and the infodemiology. So that's the last link. So there's lots there in terms of, if you really are interested in this subject, there's a lot of amazing resources out there. I think we need to develop more resources specifically for people working around vaccine misinformation. And I know that UNICEF are doing great work. I'm working with Angus, who I know is on this call, on developing those kind of projects. We're working with the WHO right now on the infodemic manager training. So the good thing is there's now a lot of people thinking about building resources for the community that's on this call. So that's exciting, but it's also important that this community learns the lessons from other disciplines, people who've been working in climate misinformation, political disinformation. So it's an exciting time.
Thanks, Claire. So there's a question for you. Could you kindly, from Akiko, could you please repeat the name of the author who proposed the ABC of misinformation?
Yes, it's somebody called Camille Francois, and she leads an organization called Graphica, which I'll put into the chat. And so she does a lot of work with political disinformation, but it's just, she came up with that concept and I really like it because I think it's an easy way for thinking about a focus on actors and behavior.
Okay, there's another interesting question from Bernadette and asking, why is it so easy for a person to believe in a rumor, yet you have to try twice as hard to convince them about the truth?
It's a great question. And this, we have to go back to psychology, is that when we as humans are frightened or scared, it means we're much less likely to be critical. And right now, because of the pandemic, people are frightened and they are scared and their lives have been turned upside down. And because of that, that's why we're suddenly seeing A, more misinformation, and B, more people believing and sharing misinformation. So again, I think I said this earlier, but we have to understand why people are susceptible to misinformation. We can't just go, oh, you're an idiot if you believe that. There is a reason, and it's partly because people feel like their lives have been turned upside down and they're seeking explanations.
Okay, thanks, Claire. So we'll take the final word from you and Saiful as we wrap up. Yes.
Well, I'll just say the fact that there are 83 people on this call, I think there were almost 100, is a great thing because the impact of misinformation is serious. 2021 is going to be a very difficult year. And I would argue that not enough people working at the highest level of health authorities understand how misinformation is impacting society. So, you know, President-elect Joe Biden created a coronavirus task force this week. Amazing names on that list. Not one person with any expertise when it comes to misinformation. So those of you on this call hopefully understand that if we don't take the communication aspect seriously, it doesn't matter how many vaccine doses we have if people don't want to take the vaccine. So for me, I know this is the work that I do every day, so of course I'm passionate, but it's really important that we take this seriously, and the fact that you're all here means that you do too. So that gives me hope on this Thursday morning.
Thank you so much, Claire.
Yes, I agree with Claire that as we mentioned that the misinformation reach people before the correct information arrives. So, and it comes, the misinformation spreads so many times that people started believing the misinformation as a correct information. So that's the problem that we need to think in depth what can be the solution for that. But as we have seen that 83 participants, yes, you are the ambassador for actually debunking or correcting misinformation in your own area. So whatever we have discussed and whatever you have learned from other sources, utilize these skills and experience and try to build your own community against the misinformation, because it's really, we are living in a world with misinformation, I should say, because every day I see that there's some misinformation is circulating. So we need to be very careful, and we also need to educate our network, because in my network, there are so many people who may not have any exposure to how the vaccines are developed, or what are the different pathways of disease transmission. So I give them some information. So in this way, if the 82% they actually educate their networks, I think that one day we'll be able to win against this misinformation.
Thank you so much, Claire and Saiful, for the interactive and informative webinar. I have learned a lot. So at this point, allow me to hand it over to Caitlin Christensen, Sabin's Vice President for the Vaccine Acceptance and Demand Program. Caitlin, take it away.
Thank you so much, Lucy, and I'll join you in thanking Claire and Saiful for a really interesting and engaging conversation, and to all of you participating for lots of great comments and questions. So just as a reminder, this was the second in a three-part series. So we're hosting our third and final session in this webinar series, co-hosted by Sabin, the Boost community, and UNICEF on December 3rd at 9 a.m. Eastern time, where our focus will be inoculation against disinformation. And we're pleased to have a few great speakers joining us then, Dr. Stephen Lewandowski, Bright Simons, and we'll be announcing a third speaker quite soon. So we hope that you'll join us, come back and join us for that discussion, and we'll be sharing information on how to register for that with participants quite soon. I also encourage you to keep up with the work that we're doing at Sabin. You can follow us on social media. Please take a look at the work that our Vaccine Acceptance and Demand Initiative is leading. We have a small grants program helping to drive social science research, looking at some of the social drivers around vaccine acceptance. We also convene the Vaccine Acceptance Research Network. And we've recently launched a number of resources for journalists and health workers through our Immunization Advocates program. You can also, on our next slide, there's information about how you can join the Boost community. We have an online platform for the Boost community. Please consider joining if you haven't already. You can find additional resources to support your work and opportunities to connect with others. Next slide, please. We have a number of learning groups. You can learn about future events and webinars and continue the conversation from today. We also hope that you will take the survey for today's webinar so we can continue to improve our offerings. Please be on the lookout for a brief summary from the webinar today. We'll share some of the resources that Claire and Saiful spoke about. We'll share some additional answers to some of your questions that we didn't get to today. And again, we'll share more information about that third webinar. So thank you again to our wonderful moderator, Lucy, to Claire and Saiful, to UNICEF, our co-partner in this effort, and wishing you all a very pleasant rest of your day. Thank you.
Thank you.
Thank you, everyone.